Well, hi everybody, and welcome to the 24th episode of Blood Matters, a podcast for nurses. I'm Michelle Kenyon. I work as a consultant nurse at King's College Hospital in London and past president of the EBMT nurses group. And I'm joined by co-host this morning, Hilda Mekelenkamp, who is the current president of the EBMT nurses group. We are very, very lucky today to have Lizzie Orrin join us for this episode where we're going to discuss cutaneous graft-versus-host disease. And I'll ask Lizzie to introduce herself in a moment, but just to give you a bit of background on today's episode, where we're going to dive into one of the most common and challenging complications after stem cell transplant, cutaneous graft-versus-host disease. Hi, Lizzie. Please tell us a bit about yourself and your role, including your experience with today's topic.
Hi, thanks, Michelle. Good morning, everyone. My name's Lizzie Orrin. I work at King's Hospital, which is based in South London. I was a junior doctor here many years ago, and I'm a consultant dermatologist now. And we see lots of individuals with GvHD or graft-versus-host. In our outpatient clinics here, we have a department of 12 dermatologists, and we work closely with the haematology clinicians, nurses. We also see individuals with GvHD when they're admitted, if they need to be admitted to King's Hospital. And I help to run a multidisciplinary GvHD clinic here at King's, which runs once a month with an oral medicine consultant, a haematologist, a haematology clinical nurse specialist, and that runs once a month at King's Hospital. Thank you.
Thanks very much, Lizzie. We are indeed extremely lucky to have such a great service from a dermatological perspective, but also that multi-professional GvHD clinic. So let's go straight in. So GvHD is an acute or chronic manifestation of this immunological process that happens when the donor T cells attack host tissue. And this is when it's manifesting in the skin. And this results in a whole range of symptoms that can be mild with some localized rashes affecting some limited areas, to severe with painful blistering lesions and skin peeling or desquamation. So skin care and skin GvHD management is really essential, not only for the patient comfort and quality of life, but also for overall treatment success. And so in this segment of the pod, we're going to be debunking some of the common nursing myths. So Lizzie, which 1 to 2 aspects of skin GvHD do you find are most frequently understood in clinical practice?
Yeah, so I'll talk about 2. So the first is that topical treatments, and when I say topical treatments, I mean creams, lotions, ointments, things that you apply directly to the skin. That topical treatments are not important if an individual is on systemic or immunosuppressant treatment for their GvHD. And that's simply not the case. They're a really important adjunct. And actually, if they're used correctly, and effectively, they can reduce the amount of immunosuppressant treatment that somebody's on and the duration that the person needs to be on that treatment for. So they're really, really important, even if somebody's on other treatments. And I guess the second myth, and this is true for GvHD, but for other areas of dermatology as well, is that topical corticosteroids that we use as dermatologists and doctors, nurses for GvHD are dangerous. And again, that's simply not true. So there are different strengths of topical steroids. Some are more appropriate on the face, some more appropriate for elsewhere on the body. But if they're used correctly for the appropriate duration of time, they're an incredibly safe treatment. And unfortunately, there's a lot of misinformation on social media and a lot of information that people are exposed to. And I think, as clinicians, we need to reassure people that actually, if they're used in the right way, they're very safe and very effective.
Thanks so much, Lizzie. Thank you. That's really helpful. And yeah, I completely agree with those 2 myths. And it's great to really hear you dispel those for us and explain some of the rationale behind that. I'm going to hand over to Hilda now. Hilda, I'm letting you speak for the first time on the pod this morning. I'm so sorry. Welcome.
That's totally no problem. Thanks a lot. And thanks a lot for joining us, Lizzie, today. And I already learned two very important aspects and two myths, actually, that were debunked by yourself. And in this part, we gonna explore some of the practicalities of skin GvHD assessment and management. And here we will uncover some insights that may not be in the books or taught at school. So my first question is actually, what practical tips can you share on assessing the skin in patients with darker skin tones, especially given the limited evidence and guidance available on this topic?
I think it's a very important question. So we serve a very diverse population of people at King's Hospital. It's when you're assessing for GvHD and inflammation on the skin, if it's more darkly pigmented, you have to pay close attention to other signs such as scale, edema, and sometimes you can discern a more purple hue that can be associated with inflammation. But in more darkly pigmented skin types, you don't necessarily see that redness, that erythema. So it's important to pay close attention for the other signs. And I think also listening to your patient as well. So assessing their symptoms as well. So are they still getting a lot of itch? Are they still getting a lot of pain? That can be all signs together that the skin is still inflamed with the GvHD.
Thank you so much. That are really important lessons. And I think not only in London there are diverse populations, but in all the world we see diverse populations. And it's really important indeed to listen to the complaints of the patients and take them seriously if we cannot see the erythema and indeed follow the other signs. And then for patients with very severe skin GvHD, it can be challenging to find the best approach in some cases. And these patients are also oftentimes medically complex and that require also care in the ICU. And for also our ICU colleagues, managing skin GvHD can be even more challenging because they are less familiar to skin GvHD. Can you share your thoughts on these kind of complex cases?
Yeah, so thankfully it's rare to have severe stage 4 skin GvHD, so where you have greater than 90% body surface area involvement with erythema and plus or minus blisters. So it's thankfully nowadays quite rare. I think it's important for the intensivist to get the support from specialists, from dermatologists, and being able to access their input, because as you say, it's rare for this to happen. I think practical considerations for intensivists. So when the skin is very inflamed, obviously you're having greater insensible losses through the skin. We have in this patient cohort, they're much more prone to getting atypical infections. So we've certainly had individuals with GvHD who then also had very atypical HSV or herpes simplex virus infections. It's very important to check flexural sites. They can be areas that are prone to getting superadded infection in people that have widespread GvHD. And the basics are still important, even on ITU. So basic skincare, so using regular 50/50, which is an emollient or a medical moisturizer, and adjuncts such as Exi-Dry sheets are important to use if people have very, very inflamed skin as well. But I think access to dermatology and knowing that they can get that support from dermatology colleagues.
Yeah, so the real multidisciplinary care of all the team members, definitely. And then probably to a more step, which we do need to do before we can see the skin GvHD, is from your perspective, are there ways to partially prevent severe skin GvHD, for example, through preventive skin care?
Yeah, so I think photoprotection is very important, and this is something that we're telling patients about anyway, because their risk of developing a skin cancer is slightly elevated compared to the general population. So I think arming people with this information about how to protect their skin and the reasons for doing that, because we know that GvHD can Koebnerize or localize to areas that have been chronically sun damaged. So I think photoprotection is very important, and also making patients aware and vigilant for the signs of GvHD so that they can speak to their nurse or doctor if they have early signs of GvHD, and so they can start appropriate topical treatment.
And in terms of skincare, could you also do something there to prevent the more severe, like using the emollients, for example, which you mentioned also earlier?
Yeah, regular use of an emollient. So, for example, it's very user specific. Different people get on with different emollients. But regular use of an emollient, early vigilance for early signs that they can start medicated treatments or steroid cream treatments if they develop early signs of GvHD, and sun protection as well.
And then related to this, what should we consider as the best practice for basic skincare during HCCT, even before we see any GvHD?
Yeah, so sun protection, factor 50 sun cream. If people are exposed to high UV, hats, long sleeve shirts, avoiding the midday sun, and as you say, regular use of an emollient.
Thank you so much. Yeah, so that are really helpful suggestions for the multidisciplinary team, and especially also for nurses caring for these patients every day. So let me go over to the next section of this episode. Over to you, Michelle.
Thanks very much, Hilda. So in this section, I really want to find out about what's hot in cutaneous GvHD. Are there any recent updates, summaries of new research or clinical trials, recommendations, any books we should be reading? What would you like to share with our listeners?
So I'll share one website. So it is from the British Society of Skin and the Immunocompromised Society, and they have resources not just for clinicians. There are some resources for patients, and it's information about how to do a full body skin check if you're a patient and you're worried about a changing mole or something on the skin, photo protection or sun protection resources, and general information about GvHD for clinicians and also for patients. So that's the British Society of Skincare and the Immunocompromised. I stumbled across an interesting paper that you might already be aware of, published in Nature, and the topic of AI is very topical and very interesting, and I'm sure in coming years it will change a lot. But it was from a Chinese team, and they looked at autonomous AI and its role in prescribing to prevent severe acute GvHD. And essentially there was a program that assessed risk in individuals, their risk of acute severe GvHD. And the program recommended whether they were prescribed ruxolitinib in conjunction with their other medications. And really it's very sort of early in sort of the group's work, but it primarily looked at how acceptable the use of autonomous AI was to both clinicians and to patients, and whether the recommendations from the AI model were complied with. So whether people went ahead with the prescription of what it told them to do. And the answer was that it was very acceptable, and that people and patients were very open to these prescribing decisions being made by an AI model which had assessed their risk of acute GvHD. So an interesting one for the future.
Oh, that's great, Lizzie. So yeah, I guess we're always mindful of kind of algorithm-based decision-making tools, and yeah, I think we're really in an exciting time where these AI models can help us to make decisions and support decision-making in a perhaps more consistent way than we do when we're left to do it ourselves. But early days, I guess, and only time will tell what the direction of travel is going to be with those. So for our listeners, we'll be able to add the website link that Lizzie referred to the pod communications, as well as the link for that AI paper. I'm now going to hand back to Hilda.
Thanks so much, and it really sounds interesting, that AI paper, and looking forward to read it more in depth. Yeah, in this last section, actually, we want to focus a bit more on the patient perspective. We do not have a patient at our table, but probably we can imagine their considerations. And based on your clinical experiences, Lizzie, with patients who have skin GvHD, are there any insights from patients with which their nurses, physicians, or dermatologists understood better?
Yeah, it's a tricky question. I think something that we often don't appreciate is the difficulty of accessing some of our recommended treatments when we see patients in clinic. I think, as dermatologists, we say, oh, use this medicated cream, I'll send a request to your GP. I think actually in this day and age, it's very difficult navigating that and accessing these treatments through the GP. So I think that's something we need to be more mindful of for individuals, and it can be a real problem, I think, particularly in the current climate where it's very difficult to get any GP appointments. But obviously, the CNS team at King's supports and sort of helps to navigate that to a certain extent. But I think it is still a problem.
And do you also have additional patient-reported insights that highlight the differences between the clinician's perspective and the patient's lived experiences in this area?
Yeah, I think some of the skin changes that you can get in GvHD can look really dramatic and severe to a dermatologist or a doctor clinician if they're not seeing them every day. But actually, a lot of the signs from GvHD can be quite burnt out. And actually, when you listen to the patient, they are not getting a lot of symptoms associated with those skin changes. So I think listening to the patient about what symptoms they're getting is such an important aspect. Don't just make a judgment on how you would feel with those skin changes.
Yeah, thank you so much. That's really important. Not only do the observing part, but also the listening part to the patient's complaints and combine it both. That's really important. Thanks so much. Yeah, and then we are already at the end of this podcast, which was very interesting. And I think for myself, I learned a lot, especially on the first part where you said that we should debunk the myth of that the topical treatment indeed is very important, aside of the systemic treatment, but also that corticosteroids are not dangerous and that we need to tell that to our patients. And what is your final takeaway from this podcast that you want to share with the listeners, Lizzie?
So I'm quite excited to listen back to the other 23 podcasts. So I wasn't aware it's such a long-running podcast. So I think that's my main takeaway.
Thank you so much. And I hope you will enjoy that, of course. And we can also recommend that to the other listeners to if you haven't done, to check our list of podcasts, which you already have done. There are really interesting topics there. Michelle, what's your takeaway from today's podcast?
Oh, thanks very much, Hilda, and thanks, Lizzie. Amazing insights that you've shared there for us. I've learned a lot myself today. I particularly liked the insights that you shared, Lizzie, around managing patients with darker skin tones and the more subtle and slightly different visual signs that we need to rely on to be able to make a clinical diagnosis. And I'm really quite excited to see the link for the paper on AI. I think that, this is an area that's quite fast moving. And, also in addition, some of the medication technologies are changing as well. So I think graft-versus-host disease is quite an exciting and hopeful area of care that we can continue to develop and to be interested in. So I want to say an enormous thanks to you, Lizzie, for joining us on the pod today. And thank you very much, Hilda, for co-hosting. We have a lot of resources on the topic of graft-versus-host disease on the EBMT website, so do please take a look there. And to our listeners, thank you very much for joining us. To our backroom team also, thank you very much for your support. To our listeners, we're very interested to hear your thoughts on this topic. What would you add from your experiences? It would be great to hear from you either via email on the EBMT website, title your comment Blood Matters, or you can leave a comment on YouTube. Don't forget to have a look at the resources that we mentioned in this episode. And thanks again for joining. Until next time. Thank you, everyone.
Thank you so much. And thank you so much, Lizzie.
Thank you so
That's
much.
amazing.